I'm a patient care tech supervisor. Basically what we do is we take care of people on their worst days. They come into the hospital with a broken bone or some medical issue, PCTs in general, try to make their day just a little bit better. A lot of it starts off with just bringing them their breakfast, help them wake them up in the morning at a decent time, get them on a circadian rhythm. And then they usually have med pass in the morning, so we get them up to their chairs so the nurses are ready for them when they show up for their med pass. Help them go to the bathroom, as well as change sheets and linens for them if they need. A lot brought me to Tahoe Forest. I started off in the Park Service when I went to attend school at UC Merced. I had an internship at the Park Service where I got to be a park ranger, and during this time I got to learn like emergency medicine in the backcountry. After I graduated college, my first job was in clinical lab testing food, but everything kind of brought me back to like helping people. So that's when I enlisted in the Army, California Army National Guard, and it was supposed to be a EMT paramedic based unit. And then that's when I finally started working in a hospital. I had stopped really liking the area I was at as a critical care tech. So I moved over to a neighboring hospital where I met this girl. And then she moved pretty much right when I got a job there to Tahoe Forest. She's like, there's some jobs up here. I was coming out to visit her, got a job at Tahoe Forest, and been there ever since. I don't know, anyone like in general in Tahoe region is just like, they just know how to hold on to you for a bit. I feel like because we're a small hospital, we can actually look at people in a more refined sense and try to help them out as much as we can. Here, you get to know your community and your patients, because a lot of them do come in, especially with the cancer center right next door. Like they're being seen for 10 plus years sometimes. That's another thing about this role that I'm in, is I do feel like nurses are too overwhelmed with doctor's orders, and they have 4 patients, they have to look up every single medication. So like to fill that void of the medical team and the patient, you have this role called a patient care tech. You know, they're there to care for the patient, you know. So I'm seeing them for the first time, don't know who they are, and I'm seeing them on their worst day. So a lot of times those people can lash out, they can be aggressive, they can be confused, they can be like withheld, you know. So I kind of always give the warm blanket metaphor, where it's like you want to go in with just a positive outlook on everything, not overly positive, but positive enough to not show fear. You prepare yourself as well as prepare the patient for whatever is to come. I will literally ask them, like, when I'm all done tucking them in, if they look like they're starting to settle, like, could I get you a warm blanket? Do you need a warm blanket? What else can I get you? I can't get you much, but I can get you this warm blanket. By offering that warm blanket, by sitting there to listen to a story. Can't tell you how many times I've had a patient that has dementia and knows 4 languages, and you can understand a couple things here and there, but like you sit down with them and like you listen to them, because they don't know where they're at. They don't really know who I am. So it's like just listen to their stories and you can't understand it. I'm just anchoring them, like, yeah, it's that warm blanket approach. I'm committed to like helping this patient. Like anything I do is helping them along their journey, no matter how small it is. That commitment to like seeing something and having that intuition to like help that person. Showing up every day and realizing that today may be a challenge, but you're here for it, is very committing. And fearlessness goes right into that too. You're fearless in wanting to go in there and committed to helping them. Imagination goes into the same thing. How do you get them out of bed? How do you create a scenario that wants them to get out of bed? A lot of the time it's like, hey, do you want to go for a walk with me outside? And a lot of times that is enough for them to be like, I need to get out of this room, and then they'll get out. As a kid, I was very excited to be outside, and it has like brought me to now where like, I just like to go outside sometimes and just listen. It's a true story. People don't believe me on this one, but taking a nap outside, listening, had my hat on, nice breeze hitting my face, and next thing I know, things are pelting my face. I look up and it's a swarm of ladybugs just like flying down this canyon. Not a lot of people can see this, and no one's gonna believe me. So we had this patient one time, she was inside for maybe 2 weeks with a bowel issue. And then one day I just remember asking the nurse, like, can I take her outside for a little bit? And she was like, yeah. We took her outside, she's still connected to the IV pole. I remember her just sitting there and just going like this for like 10 minutes. Solar bathing. So it's just like, even something that small is gonna make anyone's day better. And like, she was discharged 3 days later. So I don't know if it's a correlation or a causation, but there's something to it. So the last year and a half, my girlfriend has been in nursing school, and I have kind of like taken it upon myself to like kind of put a pause on my current progression in the medical field or aspirations, in order to like help sustain a good environment for her. And she's gonna be graduating in May, and then we plan on having a year of just kind of saving up, and then I'm gonna be applying to either PA or a DO program. I'm picturing DO, like a doctors of osteopathy, so similar to a medical doctor. I mean, they are medical, but they more practice on the holistic approach, how the body wants to heal itself and how to promote that. So I'm going long game. You know, I'm gonna be 36 this year, but I still feel like I'm really young, so.